According to scientists in Germany, a promising COVID-19 nasal vaccine can prevent a person from getting sick.
The vaccine made with a live but weakened form of the coronavirus that causes COVID. So scientists, they tested this already on hamsters and found after 2 doses of the nasal vaccine, the virus did not copy itself in the animal's upper airways. So they didn't get sick. There's still a lot more hurdles to clear before this vaccine would be available for people, but it is promising. A breakthrough trial shows a common diabetes medication may help prevent long COVID. Medical reporter Liz Bonus shares the latest research. Hey, Liz.
Hey there, everybody. Even up to 2 years out, many who are experiencing long COVID symptoms say it is life-altering.
Constant fatigue, brain fog was a bunch of it. For a while it was just like little fevers every now and then.
Kara Overstake says that's been her experience living with long COVID. We've been following Kara's story for much of that time. After weeks on a respirator at just 23 years old, she had to learn to walk and talk all over again. Nearly 24 months later,
Things do wind me very quickly, but it's better than it used to be.
it's one of the reasons Dr. Scott Woods of Ohio's Tri-Health Family Medicine says finding out what works to ease COVID's lingering impact is so critical as so many live with the aftermath. The good news, a common diabetes medication may work to ease symptoms significantly.
The results are surprising without question.
As part of this preprint, not yet peer-reviewed study in the journal Lancet, researchers looked at 3 different medications given right away after a person was diagnosed with COVID-19. 2 of the medications did not appear to impact long COVID symptoms in the months that followed.
But Metformin seemed to have a fairly significant reduction in people being diagnosed with long COVID, about a 42% reduction.
Metformin is a medicine used to treat and help prevent type 2 diabetes. It can control everything from blood sugars to kidney damage. Well, the study found it was not as effective at preventing long COVID as getting vaccinated against COVID-19. The results to prevent those such as Kara from living with these lingering symptoms do merit larger trials. Until we have them, here's what Dr. Woods says we should know.
If you really want to avoid long COVID, the first option is take the vaccine and stay up to date on that. But if the vaccine is not for you, then you can talk to your healthcare provider about Metformin. The earlier you get it in your illness, the better.
As with many other medications to ease complications, getting this medication right away appears to make the biggest difference. Dr. Woods says even given 7 days out, the benefit seems to lessen. I'm medical reporter Liz Bonus. Now back to you.
Thank you, Liz.